This video will demonstrate the use of Medical Products Resource improved version of the MPR Minimally Invasive Knee Positioner, or MIKP, featuring the redesigned ball joint block and one-piece base plate. The system is composed of the base plate locking clamp, the MIKP base plate, the MIKP ball joint block, and the MIKP universal ball joint boot. You will also need an MPR all-in-one Clark socket or MPR blade rail socket. The improved MIKP base plate design has a one-piece smaller plate with narrower sliding rail. This plate is available in both 24-inch and 30-inch sizes. The MIKP ball joint block has a redesigned smaller block to allow for tighter compression and thus a tighter fit around the boot. MPR's MIKP Universal Ball Joint Boot is equipped with a stainless steel ball that will not lose its shape over time, which will allow the boot to maintain its original secure connection. Begin by preparing the OR table, draping in the normal manner for your facility, and ensuring system components have been sterilized for your institution protocol. Attach the all-in-one rail socket to the table rail over the drape. Take care not to attach the socket over the rail supports. Slide the blade post of the base plate locking clamp into the rail socket, and tighten the rail socket knob to secure the blade post's position. To position the improved MIKP base plate, place it on top of the surgical drape and slide the edge of the base plate into the locking clamp. Make sure the edge of the base plate is flush with the edge of the locking clamp. Tighten the clamp's two locking knobs. The base plate is now secured in position. Remove one of the set screws from the base plate track so that you can slide the improved MIKP ball joint block onto the track. Make sure the block's locking lever is on the same side of the plate as the base plate's locking clamp. Replace the set screw and tighten. The set screws keep the block from advancing off of the base plate track. Note that you should adjust the block's locking lever only when the block is on the track. Operating it in any other manner places undue stress on the block structure and may cause damage. Turn the locking lever clockwise to tighten the block. If the block does not tighten, pull the lever directly toward you. Turn it as far as possible counterclockwise and let the lever return to its position against the block. Test the block's tightness by turning the lever clockwise again. Repeat this process until the block tightens sufficiently to secure the block on the track. To prepare the universal ball joint boot, line it with a sterile MPR total knee pad. Use of the foam boot pad helps protect from pressure insults and abrasions and provides greater patient comfort. Place the foot of the patient's operative leg into the boot and, starting at the toe, use sterile cohesive wrap to secure the foot and leg into the boot. As you wrap, take care to not obstruct the ball at the heel of the boot. Loosen block slightly by turning the lever counterclockwise so that the universal ball joint boot can be positioned. Place the ball of the boot into the block's round hole and tighten the locking lever clockwise. You should feel snug pressure in the lever and then continue to push the lever another partial turn. This action locks the block and boot position simultaneously. To achieve leg position needed for your procedure, loosen the block's locking lever to make adjustments to the angle of the boot and/or the block's position on the base plate track. The MIKP with ball joint block can tilt, rotate, flex, or extend the knee into infinite position by simply adjusting the boot angle and/or the block on the track. Retighten the locking lever once desired positioning is achieved. If your facility has a standard MIKP leg positioner, MPR offers options for retrofitting your system with the convenience of the ball joint block design. Contact us for details on upgrading or replacing blocks, base plates, locking clamps, and more. Discover the difference these products can make. Contact us for free product trials or pad samples and to discuss your specific needs.